Hi again. Welcome to our condition of the week. This week's condition is colic and birth trauma to the upper cervical spine. This is probably the most important video in our series that I will present. Many parents bring their children in on the way home from the hospital to have their child evaluated by us due to the information you're going to learn over the next few minutes. We have seen, over the last 35 years, we've seen babies that have responded from a myriad of conditions, not just the colicky babies, but babies that are having trouble with their bowel problems, not sleeping well, where they're waking up every few hours and parents aren't getting a full night's sleep, babies that have trouble latching on, the tongue isn't working properly. We've seen improvements with babies that are having difficulty nursing, where they can nurse better on one side than the other because of the restriction in the cervical spine. Ear infections, a huge problem for a lot of young infants and children. Growing pains, bedwetting issues have cleared up, frequent colds, scoliotic problems, bowel issues, inactive bowels, gait issues for children, inability for the baby to walk properly. They're often pigeon-toed. Babies respond from Erb's palsy, where the arm is just totally flaccid at birth, where there's been damage to the cervical plexus and they get the use of the arm back. Learning disorders, attention disorders, asthma with a lot of children, even cerebral palsy and torticollis. So there's all sorts of conditions that can be developed because of the problems in the upper cervical spine. Now, I asked you, if you think that a child shouldn't go to see a chiropractor, does the child not have a spine and nervous system just like its parents? So to better understand why they may be experiencing these issues, you may want to go back to one of the first videos that I did, which was on improving your health potential through chiropractic care. Now, when is the first time that a child could get subluxated? When's the most likely time? Birth. Birth can be very traumatic to a child. The baby is trying to pass down through a very narrow birth canal, and the mom's womb is contracting at 120 pounds of pressure. Now, what is the first thing that you have to support as that baby comes through the birth canal? You have to support the head because the neck is so strong, right? Well, the neck's like a noodle, isn't it? So there's no support. So is there just a chance that little baby's neck, as it's getting forced down through the birth canal, could get subluxated during that very short labor, ladies? The labor lasts for all of just a few minutes, right? No, sometimes it's hours to days, isn't it? And then once the baby comes through the birth canal, the doctor's actually going to traction and twist to release the one shoulder, and then traction and twist to release the other shoulder. Now, Dr. Tobin has done research on SIDS babies. This is sudden infant death syndrome babies. He's from Harvard Medical School. And what he found was that in 7 out of 8 cases, he found there was evidence of upper cervical dislocation, fracture, or brainstem hemorrhage. And he felt that of the 2% of the children that die before they leave the hospital, 30% of them are this type of trauma. Now, say the child doesn't have a fracture dislocation. By the way, the breathing mechanism for the body, the center for controlling your breathing mechanism, comes from that upper cervical part, from the brainstem, from that part of your spine. So these SIDS babies that stop breathing shortly after birth, he feels that many of them are that type of trauma. Say the baby does not have the fracture dislocation. Say they just have a misalignment or a subluxation that we've talked about in prior videos that's putting pressure on the spinal cord or the nerves. Now, as adults, we just did a video on headaches. Where do we check your spine if you have a headache? It's going to be misalignment in this upper cervical part of the spine, isn't it? Now, how can a baby tell its mom or dad that it's got a headache? All it can do is what? Cry through the night. So we see babies that have been crying for months, where they just are not sleeping well, very agitated in that. 2 or 3 simple little adjustments and they settle right down. Do you think now, have you ever had a real bad headache and feel like you want to throw up or get nauseous? Well, there's one of the cranial nerves called the vagus nerve that goes from the base of the skull all the way down to your stomach, and it gets the juices going before the food actually gets to your stomach. So overstimulation of the vagus can actually cause you to feel nauseous or want to throw up. So here's a little baby who's got misalignment at the upper part of its neck, putting pressure on the vagus nerve. Do you think that a lot of moms out there, even out there, considering that that could be a solution for the baby's colic? They got that gassy stomach, that active stomach. They're out there changing formulas and thinking they're allergic to things, and all it might be was just a little correction of the spine in that area of the upper spine, and the baby can settle right down. There was a study done in Denmark. It's not just in our office, right? They did a study in Denmark on over 316 cases of colicky babies, and in 94% of them were all back to normal within 2 weeks. There was the Gutmann study done in Germany, where he actually looked at 1,000 babies, and in his evaluation he said that 80% of the babies were actually having neurological interference in the top part of their neck and misalignment in that area. See, the birth trauma is probably, the research shows that process of traveling down through the birth canal is probably the most severe trauma that your spine will have in your lifetime. So how do we deal with this then? As chiropractors, what we do is, our evaluation actually is unique. We can actually assess the integrity of a child's nervous system. We have advanced technology that actually can scan, and it's non-invasive, it's just detecting off the baby. It's not like an x-ray. So we actually can see on the computer the areas where there may be red, blue, or green bars indicating interference to the child's nervous system. Really nice to confirm to the parent that we're finding what we're finding, because the child can't tell the mom or dad when I'm checking their spine that, yeah, that's tender there. They might see the baby move or wince a little bit if it's tender, but the baby can't say much. So these scans often are combined with what I find with my own manual examination, and they're done by my staff ahead of time so that we can put the two together. The parent can see it. When I'm finding what I'm finding, they say, oh yeah, I've already seen that on the scan. So that it confirms what we're doing there. And also we can follow up down the road after we've adjusted the child for a period of time and see that the scan is cleared up, and we know that we've got that baby functioning a lot healthier. The adjustments for children are very gentle. We tend to use, sometimes there's very little muscle control at the beginning, so sometimes it's just a very light little vibration to actually reset the atlas or those upper cervical vertebrae if the baby's just born. As they get a little bit older, we may be using the adjusting instrument. The integrator allows us to give a nice measured, gentle impulse to actually reposition the vertebrae and correct the alignment. This is information that has to get out to parents. I know that there are a lot of frustrated parents out there not sure where to go, where to turn with a lot of their babies' health issues, so please share this with your family and friends. I hope that you'll tune in next week when we'll have another condition of the week, and have a great week. Thanks very much.
Good job. So how we adjust babies is we often use a little instrument here called an integrator. It's a very gentle way of adjusting them. They don't have a lot of chronicity like a lot of adults do, so it doesn't take much force to shift these vertebrae and get the pressure off the nerves. The babies often enjoy getting their backs adjusted and that. Yeah, and they like the cuddles with mom too. Good job, Rebecca. Nice girl. Good job. All right, there you go. And that's as rough as it gets for babies. Thanks, guys.